Well, we're back right here on Hala, Kuwait, and I hope everyone out there is enjoying their evening. We have with us right now our first guest. We have with us Dr. Anila Albert. She is an ENT specialist at the Armed Forces Hospital right here in the state of Kuwait. Doctor, welcome to our program, Hala, Kuwait.
Thank you so much. It's my pleasure.
It's our pleasure to have you with us, and we're going to be talking a little bit this evening about allergies.
Yeah.
So maybe give our audience a brief before we start out with some of our main questions about allergies and what they're all about.
Yeah. Now, being in Kuwait, we know that allergy is a problem which I think most of them experience. Now, allergy is a condition where our own body produces antibodies against an allergen. So basically, it's an allergen which causes allergy. Now, allergens, we have different forms. It might be in the environment as pollen, dust, or it might be in a food. Like, some people are allergic to proteins, food proteins like egg, milk, and then some have this hay allergy. Some babies are allergic to milk. Some people do develop allergies to medicines too. That's why it's very, very important to give a clear medical history when you're going to a doctor.
Sure.
That if you have an allergy to penicillin or some antibiotics, so that they do not prescribe that to you. Because the increasing doses might be fatal even to a patient.
Exactly.
So
it's a very broad subject where a lot of people have allergies from many different things, and sometimes they even may not have allergies when they're younger, and as they get older, they grow into having some allergies.
You're true, you're true. Exactly. Actually, we've seen some people who have been, allergy-free during their childhood, and then later they develop allergy to many things which we don't know. So it's actually a tricky area where we have to deal with people.
It is.
Especially being in this country, I think the most number of patients we deal with daily on a basis is allergy.
And you said that at the top of our interview, allergies are very prevalent right here in the state of Kuwait. So, Doctor, maybe you could tell us the type of weather that causes allergies.
Yeah. Now, in Kuwait, as you know, it's too many extreme of temperatures. Like, you have extreme cold and extreme hot. So, allergies mainly happen in this transition, like, when it becomes winter, from summer to winter and from winter to summer. And that normally occurs during the month of October, and it occurs during March. So, that's the season when we say it's actually the best season, the weather is at its best. But people who are allergy prone, when they go out to the environment, all sort of pollen, all sort of dust, so they develop allergies.
It's peak time for allergies.
Exactly, and we've got a lot of patients. The hospitals are all flooded with people, especially asthmatics, people who have bronchial asthma. They have the exacerbation. That is, this comes again more. So we always advise them, avoid traveling outside during this season, stay at home, okay, and so that these episodes will not be that severe.
Yeah, so that's one of the things. So how else can we prevent weather allergies? Is it just staying indoors? Give us some general advice about that for our audience, please, Doctor.
It is difficult. Actually, the best treatment for allergy is avoidance of the allergen. Now, in weather is there in the air. You cannot do anything. So we normally advise people not to travel out too much during those times when it's dusty. Many people who have dust allergies, they do get asthma. So that's a little bit more life-threatening rather than having this normal running nose and all that you can manage. But when it develops into asthma and you have difficulty in breathing, it's a different story. So we normally advise people who are notorious to have dust allergies, stay indoors, or if it's very urgent, they have to go out, you can wear a mask. Now, with this COVID pandemic here, I think everybody has their masks on. So actually, we have seen patients coming down, the incidence of allergic people coming to our hospital for treatment has come down, in fact, with the usage of masks. Plus, we normally tell them, do not dust your house, do not get into the deep, tough cleaning. You get a help, or if you're that into cleaning, you can use a wet mopping. Like, don't just use with the duster, use with the wet mop so that, it absorbs the dust. So that's some
Otherwise, the other way can get the dust up in the air, right?
Exactly, exactly.
And trigger an attack, maybe.
Yes, yes. And we normally advise allergic people to stay away from pets. I know it's a sensitive issue, but still we tell them not to keep pets with fur, like cats, where they disperse.
Yes, some people have allergies to cats and different kinds of animals, and they should always check those out and make sure. And now, Doctor, dust is a seasonal allergy, correct?
Yes, yes. We have basically allergies of two types. It's called, in the medical terms, it's called a seasonal allergy and a perennial allergy. Seasonal happens in seasons, whereas perennial, it's throughout. The patient experiences the symptoms throughout the year. So dust is a seasonal allergy, yes.
But it seems like dust now, Doctor, is year-round. We're having a lot of dust storms all throughout the year. It's quite prevalent these days.
It's unpredictable too. That's
right.
Yeah, I know.
And so a lot of people are really affected by that. Do you get a lot of
definitely.
increase in the amount of patients then?
Definitely, definitely. We do have an increase in the load of outpatients, like people coming to the OPDs. But then some people who already know they are allergic, they take precautions. Like we've already given them some medications which will actually help in preventing the disease. So we've got a lot of medicines, like, you know, medicine has improved and science has improved,
sure.
Technology has improved. So you don't see that much exacerbation which you used to see before. But nowadays, like with the advent of newer medications, newer side effects, I mean less side effect free medications, we've seen people tolerating more also. So I guess we have a positive, I mean there's a light at the end of the tunnel.
Good to hear that. It's always good to have a light at the end of the tunnel, and also to have professionals as yourself taking care of the people right here in the state of Kuwait, doctors. So you mentioned earlier now the months that are allergy season. So it's usually, you said, going from winter to summer and vice versa, summer. What about going into fall, spring? Does that also cause some change?
Yes. It's more prevalent in the Western countries, where they have the spring when everybody is out in the garden and everybody is outdoors, and you have this release of pollen, because pollen is a notorious agent, allergen. So some people who have sensitivity towards that, they may develop severe respiratory distress, like, you know, their airway, this nose and the throat and the lungs, it's actually a continuum, it's a spectrum.
Right.
So the same change which happens in our nose, it happens in the lungs also. So a person with allergic rhinitis, means like nasal allergy, has tendency of developing asthma also. So which is more severe, it's towards a severe spectrum of it.
So they would need an inhaler then to open the airwaves.
Yes.
And there's a lot of different kinds of inhalers now too, correct?
Yes.
Antihistamines, things to help out?
Yes, I'll come into it.
Okay. So tell us now the symptoms that can cause seasonal allergies, doctor.
Yeah, basically symptoms of allergic rhinitis or allergy, it develops in 3 different areas. Like as I said, the nose, the throat and the lungs. So in the nose you have watery discharge from the nose, sneezing for around 5 to 10 times, you know, continuous, it's called paroxysmal sneezing. And then you have itching of the nose. Along with that, people do experience itching of the throat also, like they have frequent chronic cough coming. You know, many people come to us with saying that I've taken a lot of medications, I've taken a lot of syrups, but I don't have any relief for my cough. So it's not an it's not infection, but it's due to allergy. They don't realize it.
Yeah, that can be very confusing, I think.
Yes. So they go to a lot of doctors. They go to a lot
it can be confusing even for healthcare professionals, correct?
Yes. In fact, the villain here is allergen. The third area which can be affected, as I said earlier, is the lungs, where the airway, the passages in the lungs, they get collapsed or they get small. And so what happens is the patient finds difficulty in breathing. So we will have to give medications which will open up his airways. It can also affect the eyes, you know, that time people experience severe redness of the eyes, severe itching of the eyes.
Watery eyes too.
Exactly. So all this is actually a spectrum of allergy. It affects almost all the organs, especially the areas which are exposed to the allergen. Now, if you have a food allergy, for example, people who have food allergy to egg, they develop severe diarrhea. It affects the intestinal tract. Like, you know, symptoms depend on which area it's affected.
And differs from person to person.
Exactly. And they have rashes on over. So it's all the different manifestations of the different symptoms of allergy. These are basically the symptoms of allergy.
So, doctor, now why do weather changes make allergies worse?
Okay. Now, once an allergen comes into a body, like once, suppose if I am allergic to dust, during my childhood I get sensitized, like my body develops a reaction towards the dust. The second time, when again this dust comes into my nasal cavity, my body recognizes it as a foreign particle and it acts more violently. So it's actually an add-on mechanism. So the second time it attacks, this reaction becomes more. So it keeps on adding. The more frequently you get this exposure, what happens is a body automatically develops a level where it cannot tolerate it. So it's actually our body is attacking ourselves. It's like a sort of autoimmune sort of thing. That's the basic principle why people develop allergies on exposure to, you know, frequent exposure will develop in more severe symptoms. So that's how the reason is.
And of late, doctor, we even have an increase, correct?
Yes.
Is it because of all the environmental issues?
You said it, yes. Initially, when we used to, when we were in the med schools, we never used to see, young children coming with sneezing, with asthma, wheezing, and all. It was less. Those who were prone, okay. But nowadays, with the advent of more motor vehicles, people all coming to urbanization, they're all coming to the cities, and all sort of fast foods. We don't know what all agents they add into it.
A lot of pollutants.
Exactly, exactly. So it's we're living in a world of allergens, I should say. But let's see. We have hope. With the advent of medications and preventive measures, and even enlightening them with all these talks and creating awareness among the public, which should actually reduce the incidence.
Well, doctor, that leads me to my next question now. How can you treat allergies?
Yeah.
Give us some of tips and pointers for that, please.
Yeah. As I pointed out, the best treatment is avoidance of allergen. Now, if I have an allergy to a food, okay, I know I'm allergic to egg, so I'll avoid egg. Now, it becomes difficult when you have an environmental allergy. It's there in the air. I mean, it is impossible, practically impossible to avoid allergens. So, in those cases, we have a treatment which is divided into two groups. Like you have a treatment which you use for the acute attack, that is on the onset. Second, there are preventers. So, basically everybody is familiar with these medications which you take on the table, like if you get a cold, everybody knows you take a Zyrtec or a Cetirizine. It's like very familiar. They are called antihistamines.
They're basically over-the-counter medications.
Exactly. You go there, you ask for a Zyrtec, and then you're free of your symptom. You have a running nose, it stops. So, these are medications which you use during the attack, like during the attack, especially as you said, inhalers. We also use, there are inhalers which will give you sudden relief of asthma. Now, a second group of medications which is becoming more popular, or which is actually advocated, is the nasal sprays, which are corticosteroid nasal sprays, which is actually preventers. They have a very important role in further attacks being prevented. That's the mainstay of treatment. We tell them, normally these acute medications like antihistamines, and you must have heard of Otrivin, Xylolene, these are all drops which you use, you'll get instantaneous relief. But these can only be used for a short time.
So like a temporary relief, let's say.
Exactly. You cannot use it for a long time because you tend to get addicted, and it in turn produces a more of congestion. So, it's a vicious cycle. So, we normally ask people to control the immediate symptoms with a small medication, then you will carry on with these preventers like steroid nasal sprays, Nasonex, so many medications are there. We ask them to at least continue for 2 months. It's like on a regular basis. You cannot just use it like on and off. No, it has to be used on a continuous basis. Then you will get the effect. So, there are very good medications. The latest novel treatment is immunotherapy. It's like how you're sensitizing the person slowly. Like suppose if your child is afraid of the dark, you take the child to a dark room. On the first day, he'll be scared. The next day, you'll make him stay a little bit more longer. Third day, so gradually, exactly. So, that's the same principle you base on this one. Now, if I find out the allergen is some allergen, I do an allergy test. I found out what allergen is, and then the small increasing doses, you inject the allergen into the body, so that the body develops a response, like a protective response.
Sure.
So, that is the novel, the most recent development, which it's free of side effects, and gradually the patient develops a positive response to it. So, that's called immunotherapy. There are more studies coming on the way, and inshallah in future we'll have good treatment available. Inshallah.
We hope for that always, that people have relief from the different allergies that they have, because it is, as we were saying, doctor, more prevalent, a lot more people having allergies from all kinds of different things. So it was a pleasure to have you with us on Hala Kuwait. Do you have any last bit of advice or words for the audience who are watching tonight for reducing the risk of allergies, please, doctor?
Yeah. If you know you are allergic, avoid the allergen. That's the take-home message. Yani, if you know you are allergic to a particular substance, avoid it. That's the only most effective treatment you can. And please use preventers. Preventers are as medications, as I said earlier, which will help to prevent the further attacks. These are the most effective medications. Stay safe, use masks, continue, and enjoy.
Well, it was a pleasure to have you on our program, and wish you all the best of luck in your
much.
Future endeavors and in your practice. Thank you for coming.
Thank you, Thank you.
We'd like to thank our distinguished guest, Dr. Anila Albert, ENT specialist at the Armed Forces Hospital right here in the state of Kuwait, for her advice and comments when it comes to allergies.